Welcome to the Uzima Health and Wellness Podcast.
What did the doctor say?
So my question is, have you read anything about the description of how white communities characterize their substance abuse disorders? Is it any different?
Yeah, that's a good question. So I haven't read specifically on that. I can speculate based on some of the things that I've heard so far. And I think what you're also getting at is just the huge component of cultural competence and really knowing what people's backgrounds are before they get to your office. So on the one hand, we can create these systems and say, well, this is how much you can give, and we're going to monitor you and stop you once you get to this point. Or you can say, well, what's the environment that you're working in? And how can we actually help people make more improvements in those environments? So not knowing exactly how that's viewed in white necessarily versus Black communities from reading the literature, but just knowing anecdotally that there are so many important components of that. So I have a lot of colleagues who are doing this work in church communities, in Black church communities, and showing that if you meet people where they are, it's so much more effective in terms of trying to help people move forward. So it's not taking a system that may be built on other cultural frameworks or a white framework and putting that on top of the Black community, but meeting people where they are and adjusting as need be. And sometimes there's pushback. So there is, people do things like medication assisted treatment for things within opioids, and that can be really effective. But sometimes you run into cultural challenges there where people don't want to be on another medication because they think they might abuse that one as well. So it really is important to know the language of those that you're working with, where they're coming from, and to be able to move things forward. So I say there are definitely differences. It's hard for me to know exactly what those are, but I think that's part of the homework that we have to do.
That's right. And I think that the socioeconomics of drug abuse has to also play into even the racial component as well. Because if you have just, if you're just poor, low socioeconomics, your addiction and your stressors in life, it doesn't matter what your race is. And that's one of the commonalities that we can try to begin a campfire kumbaya about.
Hi, Uzima family. If you like what you're seeing and what you're hearing, subscribe to our channel. Hit the bell icon below to be notified of our recent videos. What the doctor say?